Hello everyone, my name is Denise Guzman, and for my research project I chose to do a little bit of research between the association between diabetes and developing hypertension. I chose this topic because I do work for a diabetes prevention program, working with the pre-diabetic population, and which helps those to not develop diabetes and how to reverse their pre-diabetes condition. And I know with diabetes, there, even though it's not curable, it is people are able to manage their diabetes, and so it won't lead to other chronic conditions. So a little bit of background of diabetes. Diabetes is the seventh leading cause of death in the United States. Approximately 32.2 million people have diabetes, and that is 10.5% of the U.S. population. Approximately 26.9 million people, including 26.8 million adults, have been diagnosed in the US in 2020, and approximately 7.3 million people often go undiagnosed, which is 21.4% of the US population. With hypertension, approximately 68.4 had a systolic blood pressure of 140 or higher, or a diastolic blood pressure of 90 or higher, or were on prescription medication for hypertension. This can also lead to other health problems such as heart disease, heart attack, and stroke. Prediabetes is often misdiagnosed, causing a high incidence of diabetes among people. And if not managed correctly, diabetes can lead to serious health consequences such as foot complications, kidney disease, cardiovascular disease, high blood pressure, eye complications, stroke, neuropathy, skin complications, and can possibly develop ketones. So the NHANES is designed to assess the health and nutritional status of adults and children in the United States. And I did use the data from NHANES, and the purpose of the study was to utilize the NHANES 2015 and 2016 and explore the association between diabetes and its relevance to hypertension among people with diabetes. Some of the methods, so the data was extracted from the National Health and Nutrition Examination Survey between the years of 2015 and 2016. All of my data analysis was performed in Stata. So for diabetes status, the variable name was DIQ 010, and it was used for analysis as an exposure variable. And the question associated with the variable DIQ 010 was, doctor told you have diabetes. With the hypertension status, the variable name was BPQ 030, and it was used for analysis as an outcome variable. And the question associated with the variable BPQ 030 was, told you had high blood pressure 2 or more times. So for my analysis, I did use descriptive statistics, and I used the Pearson's chi-square analysis to obtain the odds ratio, the p-value, and the confidence interval for diabetes and hypertension, as well as the confounding variables. I also used the linear regression to examine the statistical significance of each variable and creation of the final model. So a couple of the confounding variables I used. So before doing all of my data, all of the variables were dichotomized to exclude any missing values. So one of the variables I used was the gender variable, which is the gender of the participant. I also used age variable, and this was stratified into 3 groups. One of the groups was 18 to 43. The second group was 43 to 63. And the third group was 64 to 80 years old. I also used an education variable. I also used the diet variable, which it was stratified into 1 equals good diet and 2 equals poor diet. I also used an insured variable, which was either they had health insurance or not. And I also used the race variable. So for my results, this is table 1, which shows the characteristics of those with diabetes, and this shows the frequency and percent values of variables that might influence diabetes. So with the age group of 44 to 63, they had the highest percent at 46.14% of individuals who have diabetes. In the gender category, males had the highest percentage at 53.74% of individuals who have diabetes. In the education category, the 9th through 11th grade education had the highest percentage at 33.6% who have diabetes. And those who were insured had the highest percentage at 89.24% who have diabetes. Those who had a good diet had the highest percentage at 61.82% of individuals who have diabetes. So for my second table, it shows the frequency and percent values of variables that it might influence hypertension. In the age category, those who were 44 to 63 had the highest percentage at 44.95% of individuals who have hypertension. Females had the highest percentage at 51.48% of individuals who have hypertension. And those with some college had the highest percentage at 30.30% of individuals who have hypertension. And individuals who are insured had the highest percentage at 88.35%. And those who had a good diet had a higher percentage at 64.82% of individuals who have hypertension. So for my table 3, this is the table detailing the odds ratio and the p-value and the 95% confidence interval for each variable. With the Pearson's, I use the Pearson's chi-square analysis of effect of gender, age, insured, education, diet, and race on frequency of developing hypertension during their diabetes condition. So according to the odds ratio, education, diet, and those who are insured had the highest effect. And those with no education and had a bad diet are 1.61 times more likely to develop hypertension during their diabetes management or condition. And those who are uninsured are 1.34 times more likely to develop hypertension during their diabetes management compared to those insured. So for my conclusion, based on the findings, the odds ratio shows education, diet, and those who are insured have the highest effect in the chi-square analysis. And based on the results, health and medical staff and public health professionals need to prioritize to educate individuals how to manage their diabetes diagnosis. Even though it's not reversible, they can still manage their diabetes and not develop any other chronic health conditions. Diet plays an important role in diabetes self-management. Individuals need to be educated on foods that are diabetic friendly and increase their physical activity as well. Individuals should consult a dietitian for counseling and support. And also there are diabetes self-management classes within local health departments or other organizations that support and educate the diabetic population, and to not allow those diabetic patients to develop any chronic health conditions, like kidney problems or leg amputations and other more conditions. A couple of the strengths of my study was that research has been proven that with confounding variables that I use, there is an association between patients, diabetic patients who develop hypertension. Also, the enhanced data was easily available and allows for the continuing of research in this topic. Some of the limitations I had in my study, in my research project, was that self-reporting makes subject to recall bias. And after cleaning my data, there were small sample sizes in some of my variables.